We miss you too.
So, okay, so chapter review 54, and your test will be tomorrow on Edmodo. So we'll start off with, you can either take notes in a notebook or you can follow me along in your textbook, and it starts on page 1324. So you can either use a highlighter or a pen or pencil to mark things that we discuss, okay? So what are oral medications? They are anything that enter the tissues of the GI system. They are rapidly absorbed. Oral medications can be pills, syrups, or other liquids. What are sublingual medications? The abbreviation for sublingual is SL, and the most common medication given by this route is nitroglycerin. If I go too fast, raise your hand or say something. What is buccal medications, and where does that go? That goes right inside the cheek. How many times must a medication, this is in the yellow box at the top of the page, how many times must a medication be checked before it's administered? You see,
3.
you know?
3 times.
Yes, correct. So flipping on to page 1328. What are inhaled medications and what is the route? Page 1330. What are parenteral medications? These are anything that's administered outside of the GI system. This is going to be ointments, creams, injections. Let's talk about your syringe. You need to know the parts of your syringe and needle. Okay, you need to be able to label it. Okay, each one of those, there will be a matching. You're going to have to match your parts of your syringe to the definition. Okay, going down to your needles. The larger the size of the needle, which is your lumen, the smaller the gauge. Y'all follow me? So it's kind of opposite. So it's the larger the number, the smaller it is. Okay, so you have a 25 gauge needle is larger than a 27 gauge needle. A 27 gauge needle is going to be the size of a TB test. A 25 gauge needle is going to be the size of a needle that you're going to use for an intramuscular injection. Okay, so that's the difference in the sizes. It's one another. What does the term viscosity mean? Viscosity is the thickness of the medication. This is going to determine the size gauge of the needle. And that is on page 1331 under viscosity. What is the red box called that sharps or needles go in? Sharps needle glasses. That's going to be your biohazard sharps container. Medications for injection. What is a vial? These are glass bottles with rubber stoppers to protect the medication inside. Y'all all know what a vial looks like? Yes?
Yeah.
No? Okay. Go now to page 1335. about halfway down under OSHA, the concerns related to a needle stick injury are going to be exposure to HIV, AIDS, hepatitis B, and hepatitis C virus. Those are your potential exposures from a needle stick. And there you have the biohazard sharp container. Page 1336, charting medication administration. Your down where it says parenteral medications are charted using the same documentation for oral medications. I had y'all practice doing some charting after you've administered some medicine, and a couple had some questions on that. So once you've administered a medication, tell me something, Madison, that when you're charting a medication once you've given it, what is something, one thing that you can think of that has to be charted once it's been administered?
You need to chart when you administered it, how you administered it,
Mm-hmm.
any reactions after.
Okay, what about the day and time?
That too.
That too? So
Site.
the site, okay. So if you are administering a flu shot on myself, what are the things that you are going to chart once you've administered it?
You need to do the name of the medication, who you gave it to, how you gave it to them, the date and the time and the site, and if there were any reactions.
Okay, so that brings up a good point, what I wanted to mention to you.
Oral consent.
Well, true, your consent. Okay, but your site, you need to be specific. You don't need to just say, you need to be specific left, right, whether you give it in the deltoid or if you give it in the gluteus or vastus lateralis. Okay, so just make sure that you're documenting the correct site, about the manufacturer or expiration date, any of that. Do you have to document that, or is there a place on the chart that goes on?
The place on the chart that goes on with the lot number.
Very good, very good. Okay, so what are IM injections? What route is intramuscular? Deltoid muscle. Danielle, where's your deltoid?
The deltoid is on the upper outer surface of the upper arm.
Show me.
On the upper outer surface.
No. Look, Danielle.
Oh, the arm. I was just playing.
Oh, you silly thing. So how do you measure? First of all, what is the name of the bone that you are feeling for before you're giving a deltoid injection? What's the name of that bone?
The clavicle.
Acromion process.
Wait a minute.
It's not in your book. I'm telling you. Look at me, Danielle.
Okay, because I was like, I don't see that in there.
This is your acromion process. You are met, April. It's not in your book. Okay, so just follow me for a second. Okay, so your acromion process here, that is that bony knob right there at the top of your arm, top of your shoulder. Measure 2 finger lengths down. Underneath your fingers is where you can administer that IM injection.
My arm is sore.
Your arm is sore? What have you been doing?
I don't know.
So, okay. So let's get back with our chapter review, but I'll do that with a lab assignment for y'all. I just wanted to, this is not going to be on the test, but look in your textbook. Never give an IM injection in the back of the arm. Okay? That hurts. It really hurts. I had some students, whenever we were doing pharmacology in the day class, tell me that that's where they would receive their flu shot. And that is extremely painful. The back of the arm is only used for a subcutaneous injection, not an IM. What is your vastus lateralis muscle?
But
On the outer portion of the upper thigh and part of your
quadricep.
That right there, yes, ma'am.
This is the site that is considered the safest for IM injections, especially in children or small individuals with major blood vessels in the area. So let's say you have a 70-pound, 80-year-old female. Let me reverse that. 80-year-old female who only weighs 70 pounds. Her arm is going to be very, very tiny. So it's going to be very difficult to administer an IM injection in her arm. So you can use this site on an adult if they are that small. Okay, so just keep that in mind. What is the dorsogluteal?
The upper outer quadrant of the buttocks.
Of the buttocks? What is the ventrogluteal?
That's the best site to use.
Oh, is it?
That's what they said in the book.
Okay.
That is
the top of the vastus
there you go.
All right.
That's the
Okay. So
that.
we're,
No.
let's go to the top of page 1339. I want to discuss your Z-track method a little bit. I did give y'all a question of the day on that, right? Okay. So what I really want to focus on the Z-track method is it's contraindicated because it poses a risk for you as the medical assistant administering the injection, because you have your hand placed on that patient the whole time you're administering that injection. Okay, so you pose a risk for injecting yourself whenever you are giving the medication, and this that is used because of either irritation, if they have a sensitivity to medication, the medication that's administered that can cause a reaction, the Z-track method is used. But it is contraindicated because of risk for yourself being stuck for needle stick. Okay, so, and it is under the Z-track method, the very last sentence, okay? It is critically important to withdraw your needle before releasing the skin. So you're going to be holding the patient's skin tight. You need to withdraw the needle while you're still holding that patient's skin. So you withdraw your injection and then you release the skin. Okay, and that will decrease the adverse reaction of being overly sensitive to that medication if it is a highly irritating medication. Okay, you have questions on that?
No.
Okay, all right. Subcutaneous injection. The abbreviation for subcutaneous is sub-Q or SQ. This is given in the adipose tissue, which is the fatty tissue that can be given in the backside of the arm. The most common injection administered by subcutaneous is insulin. Heparin, which is the medication that's administered for blood clotting. Also immunizations. There's a couple immunizations that can be given by sub-Q route. The subcutaneous injection is given at a 45-degree angle. And your sites need to be rotated whenever you're giving any type of injection. Okay, so 1344. Your intradermal injection. The abbreviation is ID. This is commonly used for allergy skin testing, not allergy skin injection. So there is a difference. Danielle, what's the difference?
What happened? I was listening to my dog. What happened?
What is the difference between allergy skin testing and allergy injections?
The skin testing is not, I guess it's just on the forearm.
Okay.
And I know you could do a few on the back.
Okay, here's the difference. The injection is given by subcutaneous administration. The allergy testing is done intradermally. Okay, so the testing is done intradermally. The injections are done subcutaneously. That's your difference. What is a TB skin test? You don't have to tell me, I'm just for test purposes, okay? Is the route that a TB skin test needs to be administered?
We need to know the route.
Okay, so what does under IV therapy, what does intravenous therapy mean? Are you, as a medical assistant, able to administer IV medication?
No.
No. Okay. So I have moved to 1348 in your textbook. So some of your medical offices, I know, are doing IV therapy medications like rheumatoid arthritis, or if they, let's say sometimes some of your dental offices, if a patient needs to be sedated before they have a dental procedure because they have a high anxiety level, they are now bringing in nurses or people that are specialized in IV therapy to be able to start an IV on the patient and administer that sedation on them. So one of the common reasons, I said all that to say this, that one of the reasons that you have IV therapy in the medical clinic is to help cut down those hospital admissions, is going to cut down on cost, is going to increase your patient satisfaction, okay? Some of your medications that are commonly used here at the bottom of your book, of the page, is going to be your chemotherapy medications, rheumatoid arthritis, antibiotics, medications to treat anti-inflammatory diseases, and analgesics. These are commonly used IV medications in the doctor's office, okay? We're now going to 1350 of your textbook. You do need to know what the medical assistant's role is if a doctor is administering IV medication in the clinic. And what does infiltration mean? What is the definition? Going to immunizations on page 1351. Who is the CDC? CDC is your Centers for Disease Control. They recommend that certain individuals receive influenza vaccine. The age for the influenza is children 6 months of age up until their 19th birthday. Now, this is just for children. is the difference here. But any adult can receive the influenza, but this is the age specifications just for children. What is diphtheria? Okay, so I need you to understand, go over your immunizations. Look at your definition for what your injection is. The vaccine for diphtheria is given to children in 5 separate doses. What is pertussis? That is your whooping cough. What is a tetanus injection? What, on page 1352, what is the DTaP vaccine? When children receive a vaccine for tetanus, it's usually given with a combination of diphtheria, tetanus, and pertussis. That is all the medications that is contained in that DTaP, okay? Meningitis, the result of HIV, not HIV. HIV is in boy. Y'all follow me?
Yes.
Okay. The top of the page of 1353. What is hepatitis B? And what is its dosages for the vaccine? That's on the next page for the hepatitis B. Now, HPV is a fairly new vaccine. HPV is the human papillomavirus injection. And this is, this was a lot of controversy over the last few years of whether or not you should administer this injection to young teens. The ages that an HPV vaccine can be given is in females of age 13 through 26. What is MMR?
Measles, mumps, and rubella.
Also remember that once a child is given the MMR, the child is protected for life. MMR is given in 2 doses. What is the pneumococcal vaccine? What is varicella or chickenpox? Talking about polio in the next column, there are 2 types of polio vaccine, inactivated and live. This was a question that I had given you about adult and older immunizations. At 55 years of age and older should receive the pneumococcal vaccine and the shingles vaccine. Or the shingles can be also referred to as zoster or Shingrix. It's not in your book, but I do know that those are the other optional names that it's called. April, what is, how many times should a medicine be checked before it's given?
3 times.
How many?
3.
3. Very good. Very good. Okay. All right, so your test on chapter 54 will be tomorrow, and then we will start reviewing for your final for pharmacology. And your project outlines has been posted to Edmodo. Please let me know if you have any questions on that. And as the dates get closer to the time that it is due to be turned in, I will get back with you, or you can definitely reach me anytime if you have any questions on it. And then we will start, this module ends on the 7th. And so your next module will begin on next week. Okay? All right.